I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and peri-menopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. Hello, listeners. I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. And have you ever wondered about your hips and their health? Do you have hip pain? Do you have joint pain? Has somebody told you that you have osteoarthritis in the hips? And maybe it's even been mentioned that you should be considering a hip replacement. Well, today's episode is for you. I'm having a conversation with my friend and one of the Meno besties, Zora Benhamou, gerontologist and biohacker, and she has a wonderful podcast called the Hack My Age podcast. Please go check it out. But she recently, at the age of 54, had bilateral hip replacements. Now, if you happen to know Zora and you watch her Instagram, you know she is very fit and athletic and kind of is the opposite of what you would think someone looks like that needs a hip replacement at 54. And we do talk about that in this episode, but please follow her on Instagram. Her content is amazing. But we talk about a lot of issues around why it is that a person may find themselves having a joint replacement so young and the sort of ageism that goes along with that. So if you've had joint pain and you are maybe feeling kind of alone, like, why is this happening to me? I feel like I'm the only person, and what do I do about it? We talk about the different things that make you have the risk factors for osteoarthritis in the hips and the kinds of therapies that you can do to help yourself before or to hopefully prevent having to have a hip replacement. But I think probably the gold in this episode is the things that Zora did to recover as quickly as she did when she had those surgeries back to back. And I remember her texting me from the hospital bed a picture of her plate at meal times. And she had these surgeries in Spain. And so the hospitals are a little bit different than what we have here in North America. But she had double protein on her plate, and she had to order that specifically, but was able to get that because the nutrition, let's just say hospital food in North America is not something people talk about. But apparently in Europe, it's kind of different. So she had access to some different options that but she had also knew to advocate for herself and ask for the things that her body needed to heal. Please let me introduce my friend Zora. Zora Benhamou is a gerontologist and biohacker dedicated to challenging menopause stigma and ageist stereotypes. As the dynamic host of the Hack My Age podcast, she focuses on empowering women navigating the menopausal transition through biohacking techniques. At 54 years old, Zora embodies the essence of a digital nomad and serves as a passionate menopause educator. She is the visionary behind hackmyage.com and the author of the Longevity Master Plan and Cookbook, Eating for Longevity, offering invaluable resources and programs for women in peri- and post-menopause. Zora's commitment to normalizing menopause conversations is evident through her creation of the support group and community Biohacking Menopause. She completed the Institute of Bioidentical Medicine's menopause method training, Dr. Stacy Sims' Menopause for Athletes course, and is an active member of esteemed organizations such as the Gerontological Society of America, the Aging Society of America, the British Menopause Society, and the European Menopause and Andropause Society. With a master's degree in gerontology from the prestigious University of Southern California, Zora's expertise extends to sports nutrition coaching and oxygen advantage breathing instruction, further enriching her holistic approach to women's wellness. I love this conversation. It's always fun to have a repeat guest on, but someone who I adore as much as I adore Zora. I hope you enjoy this conversation as much as I enjoyed having it. And here's a word from our sponsor. Let's talk about something incredibly important, your heart health. You probably already know the stark statistic. Heart disease is the #1 cause of death in the United States. Now, it's widely understood that men develop heart disease earlier in life than women. But what you might not know is that this difference starts to change as women age. By the age of 65, women begin to develop heart disease at the same rate as men. Why does this happen? Well, the sources tell us that declining estrogen levels play a significant role. Estrogen has a profound impact on our cardiovascular system. It actively improves our cholesterol levels, keeps inflammation down, increases crucial blood flow around the body, and even helps to reduce damaging free radicals. Think of estrogen as a vital protector for your heart. It's important for our heart health, too, to take minerals. Certain minerals, such as magnesium and boron, are highlighted as being essential nutrients that our hearts and bodies need to function at their peak performance. When your mineral levels drop, it can lead to a decline in both your estrogen levels and your overall heart health. This is why I'm so enthusiastic about my partnership with Beam Minerals. They have formulated a fantastic way to make getting your daily electrolytes and essential minerals absolutely effortless. Forget about cumbersome pills or messy powders. Beam Minerals offers a simple solution. Just a small shot each day provides your body with the natural, plant-based support it needs. Ready to take proactive steps for your heart health and overall well-being? Head on over to beamminerals.com and don't forget to use my special code LOVELY to receive a fantastic 20% off your first order of Beam Minerals. That's LOVELY. Thanks, Beam. I love it when I have a guest on the show where we're laughing before we even press record. I'm bringing back an old friend today, Zora Benhamou. Welcome to the Not Your Mother's Menopause podcast.
I'm so happy to be here again. I love it. It's always so much fun to talk to you. I think we should hit record like the moment we see each other because it's so juicy what we talk about all the time.
I know, and it's topics that are relevant to women of our age, like what women want to know about. We've just finished a conversation about skincare and what we can do about that. We've had a conversation already about the hybridization of wheat and grains on the planet everywhere except the EU and Russia is what I understand, and you're going to confirm that for me. But as I have said in some of my newsletters to my listeners, actually having just traveled to Paris, and you asked about my trip, thank you very much. I got to eat all of the delicious gluten things that I haven't had to eat for over a decade, and it was so much fun. So anyways.
I'm so happy to hear that. And it's not the first time. I have people come to visit me or they go visit Europe and they say the same thing. They're like, there's something different in the water here or in the food. And I don't get as sick or I don't get sick at all or feel bad like you do or gain weight. There are plenty of people who say, I actually lost weight on my trip to Europe eating pizza or pasta or croissants or It's amazing. Yeah, I love hearing stuff like that. So
it's true. And then I've heard also, I have had patients that are celiac that have tried to sort of eat wheat and it's a hard no for them. So it literally is for everybody is going to be different on this one. So unfortunately, we can't have a broad statement on it. I wish. And for me, I tiptoed in there just to see. I'm like, oh, I'm going to be sick. I got to give it a try because I don't want to be here on the last day and try it and realize that I could have been eating delicious. I forgot I had a love affair with baguette. I thought it was croissants, or no, it's baguette for me.
Is it?
Oh, yes, it is.
Oh, for me, it's the almond croissants. Did you see?
Oh,
Oh my
so
God.
good. I have to say that
Delicious.
every day that I was there, the after I figured out I could eat gluten, I had a pan au chocolat with my cafe au lait.
Yeah. Isn't that the
Oh,
best? The
oh, it
best.
really was. It was a spiritual pursuit. Guys, we're not really talking about health food up front.
But that's part, we're bio slackers, not biohackers. We got to have some bio slacking a little bit in our lives because
Yes,
that's just being human.
no slacking. And in case, I have interviewed Zora before, and in case you need a reminder that she is a fabulous podcaster herself and part of our little group with Karen Martell called the Menno Besties. We'll have another episode coming up before too long where the three of us come together and have a conversation. But please go visit Zora's website, which is hackmyage.com, and her podcast named the same, Hack My Age. How long have you been podcasting, Zora?
Since 2020, it's 5 years
Amazing.
now. Yeah.
Amazing.
It's
It's
amazing and somehow time flies and I'm still here. And honestly, I started the podcast because my son was saying maybe I should do a podcast and so I'll play around with it. Let's see. It's stuck. And obviously there was an audience and people needed. I really thought I would just be a little thing I'd do on the side and who knows? Who knows what? It was during my gerontology studies that I started it. So it's there was a need. And as
yeah,
we grew, it's obviously more and more people are tuning in and want to hear more about menopause and I like to say longevity after menopause because as a gerontologist, I'm not looking at just let's suppress the symptoms, but we're trying to hack our age and live our best lives and protect our future selves.
amazing, amazing. And it's true. I was the same way. It was like I don't even really know what a podcast is. That was 11 years ago. I don't even know what a podcast is. I'll just go ahead and start talking at the microphone.
Crazy. Yeah,
It,
you
it's
doubled them. Yeah.
it's nuts. It's just nuts.
Yeah. Yeah.
Anyways, the podcast launched in 2015. So there we go. I know.
10 years and you're still here. It's crazy. Well, obviously, thank you for staying around so long because after 10 years, I can see people going, it's just, burnt out. It's a lot of
Yeah,
work. I don't think people realize how
no,
much work goes behind a podcast. It's not just
absolutely.
record and post it. We got
Yep.
to edit it and we have to get our newsletter out and we have to do some reels and
Yep.
yeah, not
Yes.
it's work.
When I'm in clinic, let's say I have a new patient. I had a new patient this earlier this week ask me this, and I told her, I said, I'm in clinic Tuesdays, Thursdays, and Saturdays. She said, oh, isn't that nice? So you're semi-retired. I laughed. Like, no, this is one of three businesses I have.
Yeah, if it
Anyways,
could only, but knows it may actually be one day. I think
yes,
that's where
yes,
we're heading.
exactly. Yes, it's true. It's true. All right. So I am hoping today we can have a robust conversation about your own life experience. Recently, you had hip replacement surgery, bilateral hip replacement surgery, not on the same day, but 6 months apart, wasn't it?
3 months, 3 months apart.
Wow. Okay. So as a chiropractor, I can tell you that's almost unheard of that would be that would happen that way. So I would love to unpack your story a little bit around this, and I'm going to ask an indelicate question to start. So how old were you when you had your surgeries?
54.
Okay.
54, which is
This is
way too young.
yes. Yes, we're not really thinking at 50 in our 50s about hip replacement. So, how was it that you found yourself at 54 having hip surgery?
Well, it was something I tried my hardest to avoid. And it was in my 40s that doctors, I had hip impingement. You know what that is? And you
Yes.
feel pinching sensation in the hips. And I didn't know what that was. I just felt it was blocked. I couldn't have full range of motion. You get the little niggles. And I've been told really from day one from surgeons, you need hip replacement. And I was like, ha, 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 ha. Like I am so far from that. Like,
You know what I do for a living? I'm a gerontologist. No, I don't. That's not me.
yes, yes, I will biohack my way out of this. Like, no way.
Yeah.
No way. And I was like, that's just for 70-year-olds. Like, I was very ageist, unfortunately. I'm as a gerontologist, we all know that we're all quite ageist, and we're going to try to reverse that. But there was no way. I couldn't even fathom. And so I've seen surgeon after surgeon and physios, and I said, I have to get out of this. There's no way. I mean, it's a major surgery. They cut open your hip and they cut the bone off and then they jam in this metal rod. It's so primitive. I was like, have we not moved on in medicine? Like, why are we still doing this? So yeah, I tried everything, and I think most people do when you have people tell you to get a major surgery. No one's going, yeah, let's just jump in. So, and a good surgeon, I think, would certainly say, let's try the physio. Let's try perhaps hyaluronic acid, or let's try other things, change maybe diet, or let's do it all before we actually jump into the surgery. And I did, and I have a whole podcast episode on literally listing probably about 50 things I did to avoid the surgery. And for a while, there was some things that actually worked. So I'm happy to, share. And just because
Please.
things didn't work for me, like say acupuncture, I wouldn't say don't try that if you have some hip or joint or knee problems, because I tried it because people would swear by it and said this helped them with their joint pain. So just because it didn't work for me, it doesn't mean it won't work for you. But there was some key things that kept me going from my 40s up to my 50s to say, I can reverse this, or I jump back in and the pain is gone and I'm all good. And it was all good until it didn't work anymore. And that's when I was really pushing hard, like there's got to be a way. And I still feel the body knows how to heal itself. It can. I just feel that maybe I needed more time, and I ran out of time and I ran out of money, because you need a lot of money to try all these different things if you want to try to avoid surgery. But I just couldn't. And I went to the Joe Dispenza retreats, and I did the inner work, because after a while you're like, okay, I'm looking for other people to fix me from the outside. Maybe there's some trauma in there. Maybe there's something. So I really, really worked hard to try to get there, but I never found it. And I said, get to the point where you really have practically zero mobility. You can barely walk. Everything is in pain. And the moment I felt the negative thoughts coming in, why me, poor me, this is not right. I can't go out and see my friends. I can't have sexual relationships with my husband anymore. I can't even get on a bike. I can't even get in the bathtub anymore. This is not who I am and what I'm about. And I was very transparent with my audience. And I was like, everybody was rooting and cheering for me to try to find the solution. But I got to the point, I said, this is now, the risks outweigh the benefits of a surgery, because I know the thoughts in my head have a major impact on my body. And if I have this depression, I mean, it was really depressing. I didn't quite have clinical depression, but it was depressing. And I thought, this is not a life, and this is definitely not going to be good for my physical body. And as hard as I was fighting to get out of it, you get to a point, and I think every surgeon knows this, because you just walk in begging for a surgery. And I just interviewed Dr. Von der Wright, and I know you did as well recently.
Yes.
And for the second time, because it was about 3 years ago, and I interviewed her, and after the interview, I said, look, I've got these scans. Can I send them to you? Let me know what your thoughts are. And she looked at them and she said, I think you need surgery. And I was like, blah, 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 blah. I didn't want to hear it. Closed my ears. And then when I recently interviewed her, I said, Vonda, you were right. I just didn't want to hear it. And And she says, you know, as a surgeon, you just know it has to be the right timing. You have to feel ready for that. And
Hmm.
so that's sort of been my journey. And yeah, get to a point where so that's it. I'm just going to bite the bullet. And then my mind shifted completely differently, and it was all very positive, very looking forward. And I said, I'm going to be bionic. This is going to be the best thing in my life. And at least that's the way I operate. If I have to do something, I'm just
Yes.
going to try to find the silver lining.
Absolutely. And isn't that the way to do it for sure? So it's interesting. You just talked about how you did everything that you could think of or that anybody else could suggest for you to not have the surgery. And I just had this come up in clinic this week where I had a patient that I've been treating for some time for hip pain, and she's got sports med on it and injections and me and physio and massage. And when we reviewed her x-rays, I said to her, I said, you probably are a candidate for a hip replacement. Absolutely not. There's no way I'm going there. She will go through everything else, all of these other practitioners, but she refuses to have the surgery. And I get it because I'd be the same way. I'd be like, no way, no one's going to cut into me. And I agree with what you say. The orthopedic surgeries are quite primitive, but they also have to make sure that we can withstand the forces that the body is the biomechanical forces, of course. But I agree with you. It's kind of like you're going to hammer what into where, right? So
Yeah.
I get that. And I think there's probably a lot of women that just did exactly what my patient has done and what you did, which was like, I'm going to do everything I can to prevent it. And sometimes you can't. Sometimes the best solution is the thing that you're trying to avoid. So, did you have hip dysplasia as a child?
Not that I knew of. There was only one surgeon, and I saw probably about 15 surgeons in this whole journey, more or less. And there was one who said, "Oh, you have hip dysplasia." And I said, "No one's ever told me that." And that was very recently. So just
Mhm.
before the surgery. So I am hyperflexible.
Okay.
So that is a candidate, as I
Mhm.
understand, or one of these risk factors. There are 12 risk factors of hip that had hip osteoarthritis. I think I didn't even make that clear. I didn't even really say that because and it's not osteoporosis. Osteoporosis is the loss of bone density. Osteoporosis is a joint issue. It's inflammation of the joints, and you lose this cartilage, and that's why there's all this pain. I had this impingement. So I was told, yeah, that so there's 12 risk factors for osteoarthritis, and I
Mhm.
had nine of them. Like I was
Mhm.
set up for this,
Mhm.
and being flexible is or hyper flexible, which I thought was really cool for a yoga class. And I was born
Yeah.
like that. I didn't have to work for it. I was
Yeah.
like, this
Yeah.
is great. And yeah, and not so great. And actually, I did encounter some yoga teachers who would correct me. They're like, no, 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 don't do that far. Don't you're no, not a good thing. And I'm guessing those are the ones that had the hip replacements, because evidently a lot of yoga teachers do have hip replacements too.
Is that right? Oh, that's fascinating.
Yeah.
What else did you learn along the way that surprised you?
Along the way, what surprised me was how few people talk about osteoarthritis for younger people. I felt
Mm.
very much alone. I felt very old, and I sorry, negative sense. I no one when I would search on the internet, what can I do? It was lose weight. And if you know me, it's the last thing I need to do.
Yeah.
I said, that's
Yeah.
not my problem. And I know a lot of people do because there's a lot of pressure on the joints, but I said, that's not me. And I couldn't find any answers, and I couldn't find anyone like me. And now I know, since I've been talking more and more about it and doing on interviews as well, people go, me too, me too. I'm an athletic person. Or I've had hip dysplasia or number of things. And I thought, gosh, where were you when I was really
Hmm.
searching for this? And this is why I'm so grateful that you're giving me a platform to speak about this, because there are women in their 40s and 50s who need a hip replacement, and you feel so alone. So I was really surprised that to find actually there are a lot of women out there who are like that, and I hope that this will help some people not feel so much alone, and I hope they can reach out to me if you ever need any help, because I know what it's like, and I know, yeah, where you're at.
So a couple of things come to mind that I want to sort of stitch into this conversation. As a musculoskeletal and joint expert, I talk to patients all day, well, the 3 days a week that I'm in the office, about about osteoarthritis. And my standard line for a long time is basically pretty much every spine over the age of 30, maybe 35 that I x-ray has osteoarthritis somewhere. So
Yeah.
it's extremely common. And that is the joint inflammation, the bony spurs, and things like that that grow into the joint space that causes a number of issues. And you're right. There's not enough for me. I talk about it all the time. But
Yeah.
again, there's not. When was the last time I heard somebody talking about it? Dr.
Hmm.
Wright talks about it. That's part of the musculoskeletal syndrome of menopause. We know that now. And with my professional training, I never got any information at all about how the egress of estrogen causes the problems with the joints and the muscles and the soft tissues and the intervertebral discs and all of that. By the way, during my episode, she said to me, because we talked about the intervertebral discs, which do respond to the egress of estrogen in a negative fashion.
Hmm.
And she said to me, she said it was an error. We knew about the research that showed, but it was an error that we left it out of the original paper. So it'll be in the next paper, interestingly enough. Yeah.
Wow. I
Uh-huh.
didn't know that.
Yeah,
Amazing.
so menopause does affect the discs between the vertebrae in the spine. So
Good.
she
That
she
meaning
did.
people who have back pain.
Yes.
Is that
Yes,
how it
to take it.
manifests? Yeah.
Yeah, you bet it does. And I mean, the most likely person to have a disc injury is actually a 25-year-old male because he's not listening to his body tell him to stop. And that's
Hmm.
sort of the person that's doing the gym bro stuff, the deadlifts without really doing great technique and that sort of thing. So I do talk about that quite a bit in the office as well. But um, I guess what I want to ask you is how do you feel menopause played a role in your hip joint pain, please?
Remember when I said my hacks were working until they weren't working anymore?
Yes. Okay.
That's when I was about 52, more or less. And I was on baby dosages of hormones. I was so gradual in introducing them because I was just learning about it myself. And I was
Hmm.
just doing what the doctors were telling me. So I was lucky enough to find a doctor who would give me hormones. But it was just now that I know, I was like, barely taking hormones. So I have a feeling that perhaps my osteoarthritis was accelerated during those years with just not enough estrogen on board. And since then, of course, I've upped it, but I think it was a little too late for me. So I always question, I wonder if I had robust dosages at the time when I needed it, that if I could have either delayed the surgery or avoided it, I will never know. But
Hmm.
I think that has a lot to do with it. And there was one thing, if you remember, I think it was in our roundtable, or maybe it was an episode with Karen Martell. She was
Hmm.
asking me some similar question, and she asked me, "Do you think birth control had something to do with this? Being on birth control?" And I said, "Yeah, it's
Okay.
probably on there about a good 10 years. I mean, on and off, but it is possible that." Yeah, that played a role, but I don't know the research. I don't know if there is any research on osteoarthritis. It was very specific, but
Yeah.
it,
Yeah.
it's it could be.
I, I feel like the person that would have the answer to that would be either Dr. Wright or Dr. Jolene Brighton may have some info on that because she, of course, has talked about the physiological, psychological, biological effects of the pill on women that we may not be thinking about. I
Yeah,
bet she would be the one.
yeah, and not that everyone who's taking birth control is going to have osteoarthritis or something, but there are people like me who are predisposed because of
Mhm.
genetics to this. I was athletic. I had injuries that
Mhm.
perhaps never healed or didn't heal right, and that just sets you up for these things. And then you have menopause. So perhaps yeah, as I always said, I had 9 of the risk factors. It was almost like I was set up for this. I didn't really know, but there's going to be somebody else who can go exactly the same path as me and have different genetics and have no problem at all. Never have a
Yes.
hip replacement.
Yes, yes, absolutely. Again, as a joint expert, I have not seen your scans. I don't know your health history at all. We end up, when we talk about menopause related things. So, but what I'm going to say is if you were coming to me as a patient, as you are right now, I'd say to you that it's quite likely when I see somebody that has joint stuff bilaterally, that tells me that there was a genetic thing that happened, a congenital thing that happened, probably hip dysplasia, which meant that where the acetabulum is, where the socket that the head of the femur sits into, was shallow for you at birth,
Mhm.
which meant as a flexible person and as an athletic person, your hips took far more force than we would normally have to. And that would mean that you were at an increased risk for having OA, osteoarthritis, and also for an early hip replacement, or not even early, just a hip replacement at some point. So to me, all of those things add up, right?
Yes, I think you're
Yes.
absolutely right. I think that's a really good, yeah,
Yeah.
thought pattern for me. And I mean, you have obviously more experience. I just didn't, I wish I met you earlier on and explain these things, but hopefully
Yes.
somebody who's listening now will put their
Yeah.
pieces together and may help them. And what do you do? Like if you're set up for this, should I have not exercised? Well, then that would have other problems if you don't
Yes.
move and you don't exercise. So there's a trade-off, I guess. And all we can do is weigh risks versus benefits and say, let's just go down the path of life that we think would benefit us more. And of course,
Yes.
things happen. That's just, and I
Oh,
always think there's worse things that can happen, right? And
yeah.
I was lucky I could have a hip replacement. I have a friend right now
Mhm.
who's been waiting for 2 years on the list in the NHS in the UK, and she's so desperate, and she
Mhm.
can't. She has to
Yeah.
wait.
Yeah. That's the
And
situation here in Canada as well. Is when I've got patients like the one I mentioned earlier, I said, don't worry about whether you're going to have the surgery or not. Just get on the list for the orthopedic surgeon. And after you've seen them and they tell you if you're a candidate or not, then worry about it. Because then there's like a 2 to 3 year wait list to even
yeah,
get in to see. And I want to say something that I thought about earlier when you were talking. Generally speaking, when we're talking about Western medicine is really good about minimizing a woman's pain, no matter what the cause is. That's certainly true when we're talking about things like endometriosis and fibroids and menstrual pains, PMDD, that sort of thing, right? But it's going to apply when it comes to things like osteoarthritis as well. And we don't have great pain management options for women's pain. And this is not a great sort of parallel, but yesterday I was preparing the module for the genital urinary syndrome of menopause for my menopause doulas. And so I was reading through the material and just getting more and more pissed off by the moment, Zora. I got to the section on clitoral atrophy. Okay. So 84% of women in menopause will experience some element of the GSM. And for some women, it's this, there's lichen sclerosis that's part of that. There's the clitoral atrophy. And there's a whole section on how to manage that. And I'm like, okay, wait a minute. So if we're talking about the FDA having 10 different testosterone applications for men and zero for women, we have a number of different medications for men if a limp penis enters the room, heaven forbid.
Mhm.
But women can get at clitoral atrophy and nobody's talking about that? Okay, now I'm mad on a whole other level.
Yeah, it's crazy.
It's nuts. And of course, the pain management thing, it's the same lens. It's the sort of we disappear in society
Mhm.
by certainly by age 50. There's a few of us that can hang around a little further past 50. Tamsin Fidel talks about this, of course. She had a very public job as a broadcaster, excuse me. And it's just that we need better lenses all the way around. It's important that women like you and I are on our podcast using our platform saying to women exactly what you just said. Don't feel alone. You are not alone. we're just hiding these elements because somebody said they're not savory. They're not ladylike. We can't
Hmm.
talk about things like clitoral atrophy, right?
Yeah. Yeah.
And anyways, sorry, I went off on a soapbox there for a second.
No, you're right. It's as if it's not important. And then on top of it, if it's not important, then and it's of course there's taboo and it's embarrassing, so we don't bring it up. And we we don't know if this is normal or not normal. We think maybe it's just us. And that's why it's so great we do have these platforms and internet or social media to find out that there's so many women in the same space. And I
Tons.
just saw, interesting enough, I did the CIMT scan, for
Hmm.
the artery in the neck to
Hmm.
see
Hmm.
if you have any plaque buildup in the
Yep.
arteries. And I saw a cardiologist, and she was telling, we were started to talk about estrogen and hormones and menopause, and she said she had this one client who arrived, and she was in her, I think, 70s, and she was gorgeous, makeup very, proper and lovely. And then she had to do a scan where she had to unbutton her jeans or something, or clothes, and she had a diaper on. And she said, what is this? What are you experiencing? And she said, oh, no, it's nothing. And I just, I have incontinence. And she said, but we have solutions for this. And she
Hmm.
had no clue. She just, was a little embarrassed and said, that's, the way it is. But thank goodness this cardiologist introduced her to vaginal estrogen and changed her life. And she was so grateful. I'm
Yes.
and here we are, we still, and I think this is a story that happens over and over and over again, and we don't know because we're not 70, or we haven't
Yep.
experienced this yet. And as a gerontologist, I always say that we can't imagine ourselves in our 70s or 80s when you're in your 40s or 50s. So we it's so far away, and we don't really understand what will happen. We don't know what will happen. I had no idea I
Hmm.
was going to have a hip replacement. If you told me that 10 years ago, I'd be like,
Yep.
are you kidding me? I'd be like the last person. But here we are, and shit happens. And so that's the
It
way
does.
it is. We just try to make the best of it as we can, but getting informed and listening to stories and hearing your podcast and
Hmm.
reading up on things. There's so much information out there.
Hmm.
Yeah, we have solutions. And I always say menopause is inevitable, but suffering is totally optional.
Optional. Absolutely. And it wasn't optional for the older generations, right? They did not have the options that we have. Now we have better options, but there's still a lot of barriers to care. And there's still a lot of doctors out there that are saying estrogen is dangerous for women. Give me a break. But when I hear the story of your cardiologist, I'm so, so grateful for that. I have a friend who will be coming on the show later this month that had been diagnosed with adenomyosis and told that the only treatment option was to have her uterus removed. Now she's 41, I think. And she's like that, and just newly married. She's like, that's not acceptable to me.
Yeah. Yeah.
So she found a treatment alternative that is never talked about. She traveled out of her country to go. I won't spoil the story because it's such a good story. But she traveled out of her country to actually go and have treatment.
Mm.
And she was an 8 to 10 on a pain scale, well, she says 7 days a week or 7 days a month. And then she was a 4 out of 10 on the pain scale every other day of the month. And she
Wow.
had been disregarded basically by multiple practitioners. And then when she finally got a gynecologist who said, "Yeah, it's a pretty crummy thing. Here's your pain management, and just have your uterus removed." That's the option. Imagine if that same flaccid penis showed up at the doctor and said, "My dick is floppy." And the doctor says, "Okay, we'll just remove it. I mean, you don't need it. You're
You don't
too
need
old for
that.
sex anyway." Can you imagine? And then I always say,
Yeah.
well, we've got all these medications for boners, but where do they think the boners are going to go? We need to make some moist vaginas.
Exactly. We need to find a place for those things to go. It's not going to be,
Yes.
yeah, balanced if we don't take care of everybody else.
Ladies, can we talk about energy for a minute? I know so many of you tell me you're trying everything, the supplements, the workouts, the sleep hacks, but you're still feeling tired, foggy, or just off. I get it because I've been there too. Here's what I've learned: true energy starts way deeper than we think. It starts in our cells. And as we navigate perimenopause and menopause, our cellular energy naturally declines. That's where Timeline's MitoPure gummies come in. These are the first ever longevity gummies powered by MitoPure, the only clinically proven form of urolithin A. What I love about them is that they're not just another supplement promising a quick fix. They actually work at the cellular level to improve your energy at the source and help with strength and endurance. In clinical studies, they increased muscle strength by up to 12% after just 16 weeks. Urolithin A works at the cellular level to improve energy at the source by transforming cellular damage and targeting a key hallmark of aging, helping to give you sustained energy to feel like yourself again. It's recharging your cellular batteries to combat the natural decline in energy production that happens as we age. These gummies are a game changer. They're sugar-free, naturally sweetened, and actually taste good. I keep mine right on my bathroom vanity so I remember to take them every morning. If you want to feel like yourself again and stay strong as you age, you need to try MitoPure gummies. My friends at Timeline are offering 20% off just for the listeners of the Not Your Mother's Menopause podcast. Head to timeline.com/lovely20 to get started. That's timeline.com/lovely20. Your cells will thank you. Hi there, beautiful humans. This is Dr. Fiona Lovely, and I want to share something close to my heart with you. You know how we talk on the show about the isolation so many of us feel during menopause and perimenopause, about feeling unheard, unseen, dismissed by healthcare providers who just don't get it, about wishing we had someone who truly understood what we were going through. Well, what if I told you that you could be that person for other women? I'm thrilled to introduce the Menopause Doula Certification. This comprehensive training program designed to prepare compassionate humans to support women through their menopause journey. This isn't just about hot flashes and night sweats. We're talking about the whole experience. The brain changes, the sexual health challenges, the emotional upheaval, and yes, even the spiritual transformation that menopause can be. Our core philosophy is, I see you, I believe you, and how do you want to feel? Because every woman deserves to feel heard, validated, and empowered during this transition. Whether you're a healthcare provider wanting to specialize, a wellness professional looking to expand your practice, or someone who's lived through menopause and wants to help others, this certification will give you the science-backed knowledge and heart-centered tools to make a real difference from someone who's been menopause doula-ing for 20 years. We are launching soon. Classes start January 2026. Visit menopausedoulasociety.com to learn more and join our information waitlist. Because the world needs more people who truly understand that menopause isn't something to just get through. It's a powerful transition that deserves expert, compassionate support. I can't wait to see you there.
You know, it's interesting. It reminds me of this, over 200 women I've interviewed on the street asking them about menopause. You know, I travel around the world and I ask everyone around the world, like, what's their experience like? And I've met so many women who've had hysterectomies and they said, I didn't know, I don't realize the consequences. I didn't realize that, I'd be thrown into menopause. I wasn't given hormones. I just did a presentation with a group of women, and there was a woman there who she was 46. She's had a hysterectomy, and she's she was not given, this was maybe 4 years ago. She says, no, no, hormones were not given to me. I was like, this really should be standard of practice.
Yep.
And I've interviewed other doctors who say that's malpractice to
I
not
agree.
give a woman hormones back,
I
if
agree.
especially if she's young and had a hysterectomy. Uh,
Absolutely.
so, but yeah, it still happens. I
Absolutely.
literally still meeting people like this who
Well,
didn't know.
and what I just had a patient come in the last few weeks who had a hysterectomy in the last 2 years. A woman in her late 40s was not given hormones, told she didn't need it because we retained your ovaries. Now, the thing that is not getting delivered with the information about we kept your ovaries intact is that when you remove the uterine artery, that is 90% of the blood supply to the ovaries. So
Mm,
when it goes, 90% of ovarian function is gone. So
yeah.
we're not, if the surgeons are thinking that we're bathed in the hormones that we've always had because they took the uterus out but left the ovaries, they're just wrong.
Yep.
So I mean, so much.
Yet to confirm, yeah, the woman I just talked to the other day when I had this presentation, she says, "Oh, I still have my ovaries,
Uh-huh.
but
Yeah.
boy, is the menopause symptoms bad. Hot flashes, night sweats. She's suffering. She didn't know. I mean, that's why she was
No.
attending my
That's
event.
right.
I got to
That's right.
learn what I can do.
And the problem there is not the woman that's had the hysterectomy, let's be clear. We're not here to shame anybody. We're here to point a light to a system, a medical system that is not been historically great at taking care of women's health comprehensively. It's been a matter of saying, okay, well, you don't need it, we'll just take it out, right? Rather than actually treating the problem,
Yeah. And
right?
it's and then giving them the risks versus the benefits, the full picture. Like this is what's going to happen. So you make your choice. Of course, if you're, suffering and you really need this, you need it, but this is what we're going to
100%.
do to offset any of the risks that happen afterwards. But it just seems to me, I mean, again, I'm just interviewing women on the street, but I'm just so surprised just how many didn't know, and they're learning now. They're trying to feel better, and sometimes some of them, I mean, some women are getting hysterectomies and they have the full picture and all the information and they feel better and that's great and they're being well cared for. But like you said, there's just too many women who they don't seem to be informed and not
Mhm.
helped through this process and just fall off a cliff because it's literally menopause the
Yep.
moment this gets done.
Yep, exactly. I have a friend that calls it the estrogen cliff. She's a family medicine practitioner. She calls
Mhm.
it the estrogen cliff, and I fell off that cliff a few years ago, so I know exactly what that feels like. It feels terrible. It's
Yeah.
so bad, and would you say let's talk about the risks, etc., of having the surgery versus not. I'm not sure medicine can actually give a woman the answer to that because the research isn't there.
Yeah.
We're not doing it. But it's important to note that now this is for the US in particular, which means Canada won't be far behind. A woman's uterus is big business in the United States. The number one most performed surgery in the country is a cesarean section, and number
Mm.
two is a hysterectomy. So
Wow.
it's crazy. Those numbers are bananas.
Wow. I didn't
Yeah.
know that.
Yeah. So let's talk about the socioeconomic business of it.
Yeah. Yeah.
I know
Oh, that's crazy.
it
Really
really is. So
fortunate.
these are the things that are going on behind the scenes, guys. It's you're out there trying to do the best you can. You're probably not a healthcare provider or know anything about a body really because your work isn't related to that at all. You're going to your doctor, you're trusting your doctor has the answers for you, but medicine is catching up and it's going to take time. And thank God for us scrappy AF Gen Xers that are saying, hell no, we're not going down like our mothers and grandmothers did. We
Yeah.
want better for ourselves. We saw what happened over there, and that was a disaster for women's health.
Yeah.
So, how can we do better?
Exactly.
Yeah.
Exactly. Well, that's one of the reasons also why I was so anti-surgery because I always felt, oh, this surgeon just wants to make some money because it's an very expensive surgery, right? So I get it. I get it. And there are doctors who are great and doing this is their health is in the best interest and others who don't. But it's like, how do you know? Who do you know? And that's why in the end, actually, the podcast was really my wonderful space because I did meet doctors and surgeons like Vonda, right?
Yeah.
And Dr. Elizabeth Yorth, who I eventually
Yes.
turned to from Boulder Longevity. I was like, okay, if she says I need surgery, then that's it. I'm going to do it. And I
Yes.
trusted her. So
Yes.
you got to find those people you trust that you think, no, there's no, and the same thing with Vonda. She had no like vested interest in me telling me to get a hip surgery or not. So I did, as much as I didn't want to hear what she said.
Yes.
I see. Yeah, it's you got to seek out people like that and feel comfortable with whatever decision that you're going to make, but be
Yeah,
informed.
absolutely. Absolutely. And remember that your doctor was trained in a particular system that really didn't have women's interests at heart. It's changing slowly, but you may have to educate yourself. And lots of times I will tell patients that their doctors say to them after usually I write a little note and say, is this person a candidate for hormone replacement therapy? Question mark. And progesterone or estrogen or whatever I put on that little note, and the patient will come back to me and say, my doctor said she didn't know anything about that, but that she was going to go and educate herself about it and get back to me. So it's one person at a time. It's one person. They're not bad doctors, they're just were trained in a system that was not great for us. Okay, let's turn it around, come back to this surgery business for you. So you talked about, I'm kind of putting you on the spot here, 9 risk factors for osteoarthritis. Do you know off the top of your head which ones? Again, don't worry if you don't have all 9. We can always just link to your episode where you talk about it. But do you remember what was on that list?
Oh yeah, it was. I can remember most of them. So genetics is a big
Yep.
one. Then you have injuries. You have like previous injuries, you're athletic, or you're completely sedentary, right? Or you're obese. So those were a couple of things. Your job is you're lifting heavy things, or you have a job that's with all these movements. Menopause,
Mm-hmm.
and that's
Mm-hmm.
7. And then we had trying to think a couple of the other ones that was smoking was weird.
Yeah.
Yeah, that
Yeah.
was another one.
Smoking
And
very
smoking,
much affects the spine and the joints, the nicotine in particular.
yeah.
Hmm.
And the hyperplasia, being
Yes.
hyper
Yes.
flexible.
Yep.
And those are probably, I'm missing a couple of them, but those are most
That's
of them.
That's a good
Yeah.
start. So if you hear yourself on that list, guys, just know you may be at an increased risk. It's good to go get an assessment from a physical health professional, like a chiropractor, like a physiotherapist, etc., that can actually see if there's something that can be done before you get to the place where you need a surgery. Now, I suspect in your case, or as I've said, I think the genetic component was probably number one for you, and the congenital changes that your hip that you probably were born with made it such that you were there wasn't really any other choice. At some point you were either going to be disabled by it or you were going to do what you could. I bet your outcome was amazing because of your age and your fitness level, though. Yes, am I right?
Absolutely. Yeah, no, that was very key. So one thing I never stopped was my rehab or whatever I could do, like as little movement as I could. I just kept at it. I just even just small baby movements because yeah, I continued to see therapists of all kinds, and most of them were like, just don't give up on that, because if you do need surgery, you better have muscle. You're going to
Yes.
have a quicker recovery if you need to do that. And absolutely, that's what I did. And most trainers, if you ever have any hip issues, most trainers will say the glutes, do the glutes, like every kind of
Mm-hmm.
glute exercise I was
Mm-hmm.
doing.
Yep.
Most of my upper body just like forget it. I was all focused on doing glutes.
Yep.
That my surgeon, after the
Yeah.
surgery, he came to me and he says, I had the hardest time cutting into the glutes. Like I have never had tougher glutes than you. It was so hard to cut and then open up and stick that thing in. I was like, go tell
Wow.
that to my physio, because he kept telling me my glutes are not strong enough. So he kept giving me more glutes. I think I did enough.
So did your surgeon refer to you as a hard ass, Zora? Is that what that
Yes.
was about?
You're right. I never
Okay, I
thought
love this.
about
And I know that the physios, we get quite obsessed with that whole lazy glute syndrome thing that can happen, and it's very common for women. And sometimes I think we can get those glutes reactivated, and it does posture affects it, and if we sit for our jobs and that kind of thing can affect it among many many other things, because SI joint pain is all yeah, I got you is a very very common thing. So anyways, we can get just a little too excited, but I'm so excited to hear that you had such great glute muscles. That makes me so happy for you, because your recovery must have been so good. Okay, so there were very particular things that you did to recover from this hip surgery. And I know you talked about it on your show, and you have a dedicated episode on that. But also, I saw some nuggets on Instagram, and we had a little chat about it as well. So, would you mind sharing what your surgical recovery goodies were, please?
Yes, I'm going to just skim over the stuff that we all kind of know and get to some of the advanced biohacks, because this the stuff that we know is get your muscles strong, do the rehab, bring on board supplements. Essential amino acids are some of my favorite. Get your protein in, the nutrition is there, anti-inflammatory foods. Like those are, we could do a whole episode on stuff like that. And sleep and managing your stress are also foundational, because I always say sleep is medicine. Like during this time, I know sometimes you're in pain and all that. Take your painkillers, this is all the medication that they give you. This is the time to take it. Um,
Yes.
yeah, so I want to skip over that because I could go so deep into it. But some of the things that were really interesting that were told to me, and I think people should reach out to you, obviously, if they need guidance on this, because I got guidance from Boulder Longevity Institute and their team out there, because this is not the kind of stuff you just, jump into a supermarket and get a vitamin C or something. So the top things that I think were really helpful for me were two peptides. One is called BPC 157, and the other one is thymosin beta 4. But I got the synthetic version, which is called TB 500. And these were I had two chances. I had two operations 3 months apart. So I got the first one I was using BPC 157 because this helps with tissue repair. It helps with your bones to heal, and it lowers inflammation. And I don't have gut issues, but I figured, well, I've got so much medication going into me, and antibiotics and everything. Let's just protect the gut while we're at it. So that helped me. And then the second surgery, I added in the TB 500, which is another peptide that's also for the muscles, and it helps repair, it helps heal tendons and ligaments, and it also reduces the inflammation. And very often these two are sold together. And that was just like supercharged. So those, I think, made the biggest difference on with me. And I don't know. I mean, you're familiar with these peptides, right?
Yep.
And they're used for so many
So
things.
many things.
But
Yeah.
that was given to me, or at least highly recommended to me. The other thing that I think is quite simple to get is NAC, N-acetylcysteine, and I was told to take about 1 to 2 grams for about 14 days. So it's a little bit higher dosages, and all these things are personalized, right? I'm not saying to go out and get your peptides or go out and get the NAC. Like, talk to a doctor first, or go to Dr. Fiona and get your protocol. But one thing too, actually, there's two things I couldn't get because I got my surgeries in Spain and I couldn't find it. But one was a steroid that you use in bodybuilding called nandrolone decant, and that is to help support lean body mass. It helps preserve it, and it helps with the muscle recovery, right? But they're used in smaller dosages and in a short period of time. And this has been, it's supposed to also help with the bone recovery. So that's something. Again, people go, oh, steroids and bodybuilding. I don't know. I don't want to do that. But used appropriately, I think that could have been a really great addition. But I just couldn't get it. And the other thing was cerebrolysin. I don't know if you've heard of this. It's a neuropeptide. Oh, you probably know
Yep.
this. You're all about
Hmm.
the brain,
Hmm.
and that's supposed to help with the reducing inflammation and the healing because when you think about the medications that were put on, even the anesthetic, right? And you take anesthesia so that we don't feel the pain or we don't remember. And we didn't even talk about it, but I woke up in the middle of my surgery with the saws and
Dude.
the hammers, and I was like,
Oh
whoa.
shit.
And yeah, thank God I had the drugs because I wasn't traumatized. I was just like in a
Yes.
daze, like, am I dreaming or is this real? Like what? But because of the medications, and you think about how it affects the brain and how you're supposed to not remember these things or not be traumatized by it, that's something you want to try to get out of the body and the system if you can, and that's what the cerebrolysin is for. And you take it as an IV, and I couldn't get a hold of that, but it was supposed to be about a 5-day course, 20 ml a
Wow.
day, and but I was like, oh, that would have been an interesting thing to help clear the brain as well. And then,
Wow.
yeah, isn't that crazy? And then the last
Hell
thing
yeah.
was methylene blue, and I could get a hold of that. And that's and also short term. It's like a methylene blue is you've probably seen these biohackers and taking troches or their tongue all blue, but it's actually it has been well, I guess it was one of the first drugs that was ever created, and it was used for infectious diseases, and it was some antidote for cyanide poisoning. And I met a woman who was a nurse, and she says we still use actually methylene blue for poisoning. I was like, it's always in the
Wow.
hospital. But it's one of those things that it helps with mitochondrial function so that everything can get repaired a little bit better. Antifungal, antiviral. I was like, oh, great. I'm in a hospital for 4 days. It's not like in the US they get you in and out, but I was in there and I was like, could probably use that. It's neuroprotective, reduces oxidative stress. But at the same time, it also tends to lower nitric oxide, which is something that we want. So you probably want to use this short term, and you don't want to
Hmm.
mix it if you're on SSRIs and all that. So
Hmm.
again, please go talk to a doctor or Dr. Fiona before you get into some of the stuff like this.
Yes, and of course, we've had Dr. Scott Scher on the show to talk about methylene blue. So you can go back and listen to that episode. And Dr. Elizabeth Yurth will be coming on the show. I think her episode comes out in October. So that is her talking about peptides. And of course, you introduced me to her. So thank you so much for that introduction. But I think this information that you just dropped is hugely useful. So thank you for sharing with us, Zora.
Thank you.
Well, I'm so grateful for the conversation that we've had today. Where can people find out more about you?
Hackmyage.com is my website, and all my social media is all Hack My Age. And I've got a great episode on all the details about hip surgeries, any kind of surgeries you get. I've got the protocol, and so you can go listen to that and reach out to me if you need any help. I'm here to help.
Amazing. Thank you so much, Zora Benhamou, for the time today. I'm so grateful to know you and for all of your wisdom. Thank you.
Oh, thank you.
The information and other content provided in this show or in any linked materials is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.